Cosmetic injectables like Botox and fillers are quite popular, but there are definitely some injection do's and don'ts to ensure that you are getting the best and safest treatment, so I'm going over those today. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California, and I'm here to help you understand your skin and find products and procedures that work for you. So if that sounds good, give this video a thumbs up, and don't forget to subscribe to the channel. For a very brief overview, today I'm going to be talking about Botox and fillers. Botox refers to the general category of neuromodulators, so when I'm saying Botox, I'm also including things like Dysport, Xeomin, Jeuveau, Daxxify, any of the things that you inject into your face to relax your muscles, I'm just referring to as Botox here. And then fillers are injectable gels that are used to change the structure, the shape, the volumization of your face. So they're doing two separate things, and it's important that you understand those differences before we delve into these do's and don'ts. Now, if you have more questions about like the fundamental properties of Botox and filler, I have separate YouTube videos that you should check out as well. I treat patients all the time who are brand new to cosmetic injectables, but I also treat a lot of patients who have been getting their injectables elsewhere and now do them with me. So I'm coming at these cosmetic injections do's and don'ts from the perspective of a cosmetic dermatologist who has treated thousands of patients and continues to treat patients every week in my clinic. These do's and don'ts are going to be based on questions that my patients have, questions that I get on social media all the time, and I'm really going to try to guide you through to get the most successful injectable experience. Now, beauty and injectables are quite personal, and every dermatologist or other aesthetic provider has a slightly different approach to this kind of thing. In general, overall, as an injector, I'm quite conservative. The number one priority I have for my patients is their safety and well-being. That is of the utmost importance. And then, of course, the aesthetic outcome that they achieve always needs to look natural. My goal is always, how do I get my patient to meet their aesthetic ideal with doing as little as possible? There are definitely limits on what cosmetic injectables can achieve for someone, and it's really important that someone understands that, not only the patient, but also the injector, to ensure that the patient always continues to look like themselves. The number one do when it comes to getting cosmetic injectables is making sure that you are going to the right provider. And I understand that is a way easier said than done. It's maybe one of the most common questions that I get on my YouTube posts as well. Okay, how do I find someone good? My top recommendation for finding a good injector is by going off of the recommendation of a friend or family member whose work you like. If you're looking at a friend and you go, wow, she looks really good, she looks really natural, I don't think it's weird to go up and be like, hey, who does your Botox, or who does your filler? And if they don't get Botox and filler, they'll just tell you, and if they're a good friend, they'll also tell you who does it for them. The vast majority of my patients have found me through word of mouth recommendations from their peer groups, for example, like online Facebook groups like Nextdoor or local moms groups. Those are the places to be looking for a good derm. Now, if you don't have people that you can get recommendations from, this is where it gets a little bit tricky because it's sort of the Wild West when it comes to who's able to do cosmetic injectables, depending on what state you live in. For example, in some states, an esthetician can give you Botox, whereas in California, you have to be a nurse, physician's assistant, or doctor. So you always want to look at someone's credentials. Are they an MD or a DO? Are they a nurse? Are they a physician's assistant? Not to say that physician assistants or nurses can't be amazing injectors, but for some people, it's really important to them that they're going to a doctor, and a doctor who trained in an aesthetic specialty like plastic surgery or dermatology. Another thing you can look for, which I would say is kind of like a green flag for an injector, is whether or not they train for a cosmetic injectable company. A lot of us teach other doctors or nurses or physician's assistants how to inject, and in order to do that, you get highly vetted, not only on your ability to inject safely, but also to create a beautiful aesthetic result. And I also think when you're trying to find your injector, it's okay to just go in and have a consultation and have absolutely nothing done. You can meet with the staff, see what the vibe in the office is like. Does it look clean? Do they respond to your phone calls well? Do the staff look normal? Does your injector look good? Because if you're looking at your injector and they have some weird filler going on, like, can you trust their eye? Now, I don't think you can fault your injector if they look older, but they look normal. Like, all of us are going to get older with time, but I think where people should kind of have a little bit of like a spidey sense going off is when they're looking at their injector and they're going, I can tell you have a lot of stuff done. And if you don't want that aesthetic for yourself, then maybe press pause. There are two other kind of like major red flags I would say when you're looking for a cosmetic injector is, one, if you meet with an injector and you feel like they're really pushy or they are forcing things on you or making you feel bad about yourself. I would say that, of course, your injector is going to know more about cosmetic injectables than you you do. This is what they do for their job, but they still shouldn't be making you feel like you need to do these things. As a cosmetic dermatologist, I will always guide my patients towards things that I think will be more beneficial for them based on their budget and their aesthetic goals, but I never want them to feel pressure to do any of it. The other red flag is if the deal that you're about to get feels too good to be true. Generally, injectables like Botox and filler are quite pricey, and if you're going to a place that feels heavily discounted compared to other offices in the area, you need to wonder why. The aesthetic industry can be quite competitive and quite expensive to get into because products like Botox and fillers are pricey, and people are not always taking the most ethical route when purchasing these things for their clinic. They might be buying counterfeit product or purchasing from non-verified retailers, and that's always a no-no. If you're brand new to cosmetics and you're like, well, I don't know how much Botox and fillers should cost, you can check out websites like realself.com, which kind of give you price estimates based on where you live. So yes, first and foremost is finding a great injector. That's going to save you a headache in the long run because then you don't have to worry about what product is being injected, the technique they're using, because that is all wrapped into the package of having someone you trust treat you. Another cosmetic do for me is allow your Botox to mostly wear off in between appointments. I feel like sometimes patients feel that they need to come in for their next Botox as soon as they start to see any small amount of movement, but you actually don't want to do that. The reason for this is Botox works by relaxing muscles. When those muscles are relaxed, they are not exercising, if you will, so they can thin out a little bit or debulk. When that happens just a little bit, it's not a big deal, but if you were to get Botox back to back to back over years and years and years, the muscles in your face can thin out more significantly, and that can alter your appearance. Now, that doesn't mean that you need to have your Botox return to full movement and exercise your forehead in between sessions, but I personally recommend that my patients wait till at least 90% of their movement is back before their next injection session. For most people, that is going to be between 3 and 6 months, and that is going to depend on a lot of different factors, including how much Botox is getting injected, where it's getting injected, and the overall technique. Now, I have seen this myth perpetuated on like Instagram and TikTok that if you continue to get Botox in your face, it's going to fall because those muscles weaken. That's not how it works. The muscles in your face don't hold your face up. The only time you really have to think about that is if you are getting your masseter muscle injected. So the masseter muscle is a big, bulky muscle in the back of the jawline. Some people will get it injected to slim the face. Other people will get it injected to help with TMJ or jaw pain issues. And that is a big enough muscle that if you were to hit it over and over again with Botox and it were to slim down too much, it would actually allow this tissue along your jawline to fall forward and it could give you a jowl. I've only really seen this happen in older patients because the skin has lost its elasticity, so it can't rebound when the muscle is shrinking. However, in patients who are in their 20s and 30s who are getting masseter injections, I've essentially never seen this happen because their skin is healthy enough and strong enough and elastic enough to sort of shrink back down to wrap around their new facial structure. Another do when it comes to getting cosmetic injectables is being fully aware of the aftercare and the potential side effects. Now, this is absolutely something that your injector should go over with you, but if you have any specific questions, make sure you ask them too. For example, when my patients get Botox and filler, I ask that they don't do any vigorous exercise for the rest of the day, but I'm okay with them doing something like a walk. Every injector is gonna have their own personal preferences to this. I try not to limit my patients too much because a lot of those limitations are not really rooted in any type of science. It just like makes the injector feel better, but intense exercise is off the table. I think it's also important to understand what your discomfort level may be, what to do if you get a bruise. Those are all things that your injector can walk you through. None of these things are bad things. They're expected when you get injectables. When you are putting a sharp needle through the skin, it's expected to get a bruise once in a while or to have some swelling. But if you're going into those injections expecting that you're gonna walk out of there looking 100% fine, feeling 100% fine immediately, you need to recalibrate. Another big do when it comes to Botox and fillers is speaking with your injector about your prior Botox and filler experience. Anytime I have a new patient in my office who has previous cosmetic experience, I wanna understand why they're in my office now. Is it because they moved? Is it because they've had previous bad experiences? Is it because they just wanna try something new? But I wanna understand where they're coming from. This is not only going to allow me to give them a better treatment. For example, if they said, hey, like I didn't like my Botox in the past because it made my eyebrows feel heavy, or I was too frozen. Those are all really important things for your injector to know. Also, if you've ever had an allergic reaction or a sensitivity to an injectable, it's important that your injector knows about that so they can choose alternative things to inject you with. Sort of in this same vein, I think it's nice if you keep track of what injectables you've had in the past. I don't think you need to know exactly how many syringes and exactly where they were put, but if you have an idea of, oh, I've used Dysport in the past, or I have Juvederm Volbella in my lips, like those are all helpful things for your injector to know. And I feel like in general, you should just feel comfortable asking your injector questions. If you feel intimidated by your injector or you feel like questions would be unwelcome, That's another thing to think about. Okay, I have a couple more injection do's, and then we're gonna move on to the don'ts. Do take periodic pictures of yourself as you go on your cosmetic injectable journey. You can do this at home to a degree, but you wanna make sure you have standardized lighting and you're posing the same way, but I think it's better if your injector takes standardized photos of you in the office. I always like to take standardized photos of my patients as they progress through their cosmetic treatments because there is this concept in cosmetics called perception drift. And perception drift is essentially your inability to think back on what you used to look like before you started having things done. And the risk is that as your perception of yourself drifts, you may start to not look like yourself anymore. So with all of my patients, I'm always looking back at their original cosmetic photos, and when we are 2, 3, 5 years into their cosmetic journey, we always want to be able to look back at that original one and go, this person just looks like the best version of themselves, not like someone else, not weird, perfect. On the topic of technique, which is going to vary from dermatologist to dermatologist or other aesthetic provider to provider, one thing I think that is really worth considering, especially if you are a younger patient getting cosmetics, is to think about getting a lip flip with Botox before getting lip filler. To explain, a Botox lip flip works by relaxing the muscles around your mouth so that when you smile, your lip doesn't curl inward. Some people, when they smile, will notice that their upper lip sort of disappears, and when you get a Botox lip flip, that no longer happens. So you see a lot more of the pink part of your lip when you smile, but also even when your mouth is at rest, your lip is everted or flipped out a little bit, and it can be a really subtle way to give the appearance of more volume. Now, a Botox lip flip is not going to last you as long as getting lip filler. You have to re-up it every few months if you like what it does to your face, but I feel like for a lot of people, it looks a lot more natural, and it's actually the type of volume they were hoping to achieve with filler. Now, lip filler, which more people are familiar with, is actually injecting a hyaluronic acid-based gel into the lips to give them more volume overall. And that's not really going to affect what your lips do when you smile. So if your lip turns inward when you smile, that's still going to happen if you have lip filler. So it's also not uncommon to combine getting a lip flip with getting lip filler. But if you are new to any type of lip augmentation, I would just do one at a time to start. For a long time within the aesthetics industry, people were taught that lip filler would dissolve over the course of 1 year. But what we found over time is that filler kind of hangs around, and that's not necessarily a bad thing. Well-placed filler can last a lot longer, and then you don't have to re-up it as much. But for my younger patients, I try to avoid putting a lot of filler in their lips because that can accumulate over a lifetime, and we don't want them to get distorted as they get into their 30s, 40s, 50s, and beyond. So for me, for example, I put a little bit of lip filler in my lips every 2 to 3 years at this point, and then in between, I'm just doing a Botox lip flip. Enough with the do's, let's move on with the don'ts, because this is really going to encompass a lot of the mistakes that I see people make with injectables that lead them to being dissatisfied with their treatments. Number one, and I say this all the time to my patients during their cosmetic consultations, is do not do the wrong thing because it's the easy thing. And really where this comes into play the most is when people are dissatisfied by the deep folds in their face. So they have really prominent, what we call nasolabial folds, they have really prominent marionette lines, and they're coming in asking for filler to fix those. Now, filler is a great way to volumize tissue, but it's not great at repositioning tissue. So I feel like a lot of people are like, well, you can put some filler in my cheeks and that will just lift everything up and pull away those nasolabial folds. That's not really how it works, despite what you might hear on social media. Another thing people will ask for is, okay, well, can you put filler directly into my nasolabial folds or directly into my marionette lines to camouflage them? And here's why that's not always a good idea. If you have a true volume deficit, so a loss of volume in your face that is contributing to those folds, then putting filler in there can be a really nice way to camouflage those. However, for a large number of people, these folds are not caused by a lack of volume. They are caused by a descent and repositioning of their facial volume. So by putting more filler into those areas, you're actually just gonna make the lower part of their face look fuller, which is not their ultimate goal. And I talk about with patients this being the wrong thing, but the easy thing, because it feels like you're putting a Band-Aid on the problem. But the reality is, if you have these deeper folds, you need a facelift. You need some type of procedure to lift those tissues up and back and reposition the volume where it belongs. When you see people walking around your community looking off, they look puffy, they look full, they might look a little bit monkey-like or chipmunky, it's usually because filler has either been placed incorrectly or to correct the wrong thing. Now, I feel like a lot of cosmetic injectors and patients fall into this trap a little bit because a patient will come in and say, listen, I don't want to do anything surgical to alter my face. I'm never going to have surgery, so can we just use filler to try and fix these problems? But that is how a patient ends up looking weird because it's not the right treatment for them. I would much rather say no to my patient and just say, hey, Filler's not going to work to achieve what you want here and to allow my patient to look a little bit older, but still look normal. I say this all the time, it is better to look old than weird. I say it all the time in clinic and I stand by it 100%. Filler, and even combining filler with lasers and other non-invasive tightening devices, is never going to compete with what a facelift can do. Like, they are not the same things, they cannot achieve the same outcomes. When I teach cosmetics, so for example, when I'm talking to dermatology residents, I talk about two general categories of people and how they age. There are people who sink, and then there are people who sag. My sinkers, if you will, get hollow as they get older, and those are the people that respond well to volume replacement and fillers. My saggers, on the other hand, don't get hollow, but rather their volume gets displaced downwards. So these are people that have the jowls, the turkey neck, the more prominent under eye bags, and they don't do as well with filler because they don't have a volume problem. Well, they do have a volume problem, but it's not a lack of volume, it's a displaced volume issue. So for my people who sag, you are generally much better surgical candidates, and for my sinkers, that's where we can stave things off a little bit more with things like filler. That's not to say saggers can't benefit from filler, but it's going to take a very nuanced eye and a really keen approach to ensure that you still look natural and normal getting those injections. Another big Botox and filler don't is do not get any type of injections within a couple weeks of a big event. Even if you've had your Botox done 100 times before, you've had lip filler and you've never gotten a bruise before, you never know what can happen during an individual treatment session, and you need to account for that. For my patients who have a big event coming up, whether it's a wedding, a big anniversary, even like a family photo shoot, I don't like to do any injectables within 6 weeks of that. 1, if they get a bruise, I want that to have ample time to go away. 2, if they need a tweak on their Botox or fillers, I want their Botox and their fillers to have settled for at least a couple of weeks before we make any adjustments. And I need time to not only see how things settle, but then also make the adjustments and let those settle before the big day. This also applies to getting injections right before you go on vacation. You do not want your Botox kicking in mid-vacation and realizing you have a weird spocky eyebrow, or your lip filler kicking in and realizing you have a nodule that's showing up in all the photos or is causing you pain or discomfort that you now have to deal with on your trip. And again, these things are so rare, and I feel like sometimes the more people have gotten cosmetic treatments, the more they forget about the fact that these things always could have potential side effects. These are serious medical treatments and they should always be taken as such. And then my final don't, at least for this video, if these are helpful and you have more questions, definitely put them in the comments, is don't be afraid to get your filler dissolved. As I mentioned earlier, we now know that fillers can last in the tissue a really long time. And that is not necessarily a bad thing if they are in the position that they were initially injected in and you like what it's doing for your face. There's been a lot of commotion online about filler migration and filler moving in your face as you get older. It's not necessarily that the filler is moving on its own, but as you get older, your facial structures shift and your filler can shift with you. And for most people, that's going to be undetectable, but for some people, that filler now may be in a position that's not as cosmetically flattering. And what I would encourage patients to do is not wait it out for their filler to disappear on its own, because sometimes filler is lasting 3, 5, 10+ years, and you don't want to be living with it for that long if you don't like what it's doing for you. Just last week, I had a patient come in who got filler like 6, 7 years ago in her lips, and she had these annoying nodules that had persisted. And 1, she thought they were always just gonna go away, so she was sort of just living with them. And 2, she was nervous about having something dissolved, so she didn't get it done. But after we talked and she had her consultation, she realized getting fillers dissolved in a safe medical setting is not that big of a deal. It's a little bit uncomfortable, and generally you're going to have to pay for it if you're not getting dissolved by the person who injected you in the first place, but it can be so worth it. And the thing that was really nice about this is after we dissolved the filler on the inside of her lips, it actually changed the positioning of her lips and how they laid over her teeth. And overall, her mouth just looked so much better and so much more natural afterward. And there have been plenty of times that I have dissolved someone's old, bad lip filler or under eye filler. Tear trough filler always looks messy. And then we go back in later and refill it. I generally want at least 4 weeks in between when we dissolve and refill, but that is always an option. I think we'll end this round of injectables do's and don'ts right here. Now, if you have additional questions, please let me know in the comments. I hope you found this helpful and this will help guide your future injectable journey. Don't forget to like this video and subscribe to the channel, and I'll see you next time.